Thank you for the introduction. My primary focus is to design search solutions for EBSCO Health. We are the leading provider of evidence-based content for point-of-care practitioners. Our search engines are one way in which we deliver this content to our end users. For example, a physician in the emergency room may use our search engines to diagnose and treat patients. So as you can imagine, our end users are extremely busy. They also need to consume a large volume of medical research that's published annually. So my mission is to deliver the most precise search results as possible. I really need to shorten the time it takes to answer critical clinical questions. Now, in order to achieve this goal, I really need a deep understanding of user intent. So I'm going to start off with an overview of our knowledge graph. I'm going to talk about the challenges that we face when we rely solely on the knowledge graph for user intent. I'm then going to talk about two applications that I built to address these challenges. The medical search platform and query intelligence work together to construct runtime-specific search strategies based on user intent. I'm then going to talk about how we tune these strategies and then also what's on our roadmap. So let's take a look at our knowledge graph. Our knowledge graph is composed of over 10 data sources coming together to construct over 300,000 concepts. We have 1.6 million terms across 24 languages and 6.2 million relationships in this graph. Now, we actually export a subset of this graph for our runtime environment. Now, this subset actually represents a close alignment with our domain and our content. So we use this knowledge graph in two ways. First, in our offline process, we use it to enrich our content. We also use it to perform query segmentation. So ultimately, the goal here is whether someone searches for nursing or infant breastfed, we ultimately want to identify that as a singular concept. Now, as I'm sure we're all aware, when end users search, they often don't take into account the order that the terms are entered. So in this particular example, paralysis facial nerve, if I were to inspect in my graph, based upon this order of terms, I would end up with 3 mapped concepts. But really, a more precise match for this would have been if they had typed in facial nerve paralysis. And then, of course, this is my worst case scenario, if they had typed in paralysis nerve facial or nerve paralysis facial. So really, what I want to do is come from a paralysis nerve facial to a very specific concept in my graph, which you can see would actually align with what has been semantically tagged in my index. So a brute force approach would be obviously to take each of these tokens and see if I can find a match in my graph. We then go ahead and take another pass to see if we can find a more precise match. Here I've been able to take 3 tokens and then bring it down to 2 concepts. And then finally, by applying permutations, I'm able to become more precise and make that key alignment between the search and my index. Now, we also need to support fuzzy matching when we interrogate our graph. So in this particular example here, breastfed would not be found. So you could argue, well, simply do an edit distance. But as you can see here in these examples, if you apply an edit distance of 1, the actual meaning of the concept can change right dramatically, and in this example as well. So we do apply fuzzy matching, but we do it in a conservative manner. All right, so let's go ahead and understand the challenges of understanding user intent when we rely on a medical knowledge graph. So here is a classic query that we see quite often. This is highly ambiguous. As you can imagine, physicians often speak, think, and search in acronyms. Now, AF could mean atrial fibrillation or amniotic fluid. It turns out we actually have 16 concepts in our knowledge graph that are mapped to AF. Now, when I index my content, I am able to disambiguate this acronym because I have context. But when I search, I don't necessarily have context. So if I relied on my knowledge graph to build my matching criteria, I would have way too much recall and not enough precision. So really, my knowledge graph really just adds noise. It doesn't really help me understand intent. We also have very general queries. So here's an example of a query for breast cancer. And here are some common titles that you'll see in our index that mention breast cancer. What you see here is that we have two concepts at play. We have breast cancer, chemo prevention, breast cancer, women, inflammatory breast cancer. So really, these are all excellent hits for the particular query. Who is to say that one is more relevant than the other? Well, it turns out I actually have a target title in this list that should be shown at the top. And that title is breast cancer in women. But my knowledge graph is never going to help me achieve this. Now, there's other times where I can semantically understand a particular term, but that doesn't mean I really understand what the intent of the user is. So headache is an example of this. Headache could be a side effect of many drugs, or it could be a symptom of a medical condition. So essentially, if I were to use this to construct my criteria, I would have way too much drug content flooding my search results. Now, I have some precision that I'm able to gain by using my knowledge graph. So in this case, Zoloft pregnancy. Zoloft is a brand name. It's highly specific. But the problem that I face here is I don't actually have content that mentions Zoloft. Actually, my content refers to a class of drugs known as antidepressants. So I could go ahead and I could inspect the relationships in my knowledge graph and try to make a connection between Zoloft and antidepressant. And as you can see here, I was able to make that key connection that I was looking to find. But look what happened to pregnancy. I lost quite a bit of precision here. And this really isn't the intent of the user. The user really would be satisfied with antidepressant or Zoloft and pregnancy. I also have searches where an individual is looking to compare two different substances or drugs that treat the same medical condition. Zoloft Wellbutrin is an example of this. I essentially, in this particular query, would like to take them to a comparison chart. So, in order to understand this intent, I could, again, look at the relationships in my graph and see if I can find a connection. And here, you can see I've identified that Wellbutrin is an antidepressant, and Zoloft is as well. So this is excellent, right? I've been able to make this connection. But there's a problem here. Let's take a look at Humira rubbing alcohol, also both substances. If I go ahead and I apply that same logic, you'll see here that I was able to find commonality between them. But the intent of the user here is not to compare Humira versus rubbing alcohol. No, the intent here is to understand how to apply rubbing alcohol prior to injecting Humira. So really what we're getting to here is this idea of clinical intent. Our practitioners oscillate between different phases of patient care. Sometimes they're focused on prevention, other times they're focused on diagnosing, treating, and monitoring patients. So what if I devised search strategies and aligned them to these intents? Perhaps the majority of my use cases fall under diagnosis and treatment. And perhaps I have edge cases that fall under monitoring and prevention. So really, you can think about query intelligence as a snowball. The core of it is the medical knowledge graph. And when you were a kid and you wanted to make the snowball bigger, you rolled it through the snow to add more layers. So we do the same thing, but our layers are called intelligent plugins. They really have a very specific understanding of a certain domain. Once we have extracted this information, we can then build intent recommendations. So let's take a look at under the hood of query intelligence. On the left-hand side here, I have very generic or general plugins. And these can be used across multiple products. So for example, if someone were to search for girl, my population plugin would recognize that girl is a population of children, whereas my gender plugin would recognize that girl is a female. On the right-hand side here, I have plugins that are specific to different products. They specialize in a particular product. So for example, a search for colonoscopy would have a very different click-through rate based upon the product. Additionally, the structure of the content and the categories in that content would be drastically different. All right, so let's throw all the plugins on the floor and pretend they're Lego blocks. Now let's go ahead and construct different workflows that allow us to achieve this user intent. So here is the most basic definition of intent. This one is completely independent of any product. You can see we have a concept mapping specialist, an expansion specialist, recommenders, such as gender, population, and then of course a renderer that collects all these recommendations that it has received and then spits it out. Here you can see one that's for a particular product. So you can see the ability to reuse the generic plugins and then have more specialized ones, and so on. So we have many different flavors. So really, the architecture is designed to be very plug and play. You pick and choose which intent plugins you want, and then you can construct this workflow that consumers can use. So let's put this all together. The search runtime environment receives a query, and the first thing it does is it passes it off to query intelligence and asks, what is the user intent? It uses this information to construct runtime-specific search strategies against Elasticsearch. So let's go ahead and look at some examples here. So what I'm going to first do is show you some example payloads from query intelligence. I'm then going to show you a snippet of the search expression that is constructed in the medical search platform. Now, really, these queries are quite large. We rely heavily on the dismax. So you'll just see a little bit of a snippet of some of the search. Okay, so here is a query intelligence recommendation for the search AF. And the first thing you see here is the semantic recommendation for the token AF. And as you recall from earlier, this was a highly ambiguous acronym. So what I have done here is disambiguated it in the lack of context. So I've worked with subject matter experts who have said, hey, if you don't have context, go ahead and assume that AF means atrial fibrillation. And you can see here with my click-through recommendation that that assumption has been validated. Our users are, in fact, clicking on that particular title. And then again, we have a category recommendation that continues to reinforce this decision that we have made. Now, you'll notice for each of these recommendations that there's a confidence score associated with them. And under each recommendation, you may also see weights that, again, indicate a degree of confidence. So the medical search platform is going to consume this JSON, and it's going to decide which components to use for its matching criteria and which for its ranking criteria. For the matching criteria, it's primarily going to be the semantic recommendation, and then the click-through recommendation and category recommendation are going to be the tie-breaking ranking criteria. So here is the semantic recommendation being used as matching criteria for the title concepts field. And as you can see here in this snippet of my semantically enriched index, I've been able to make that key connection between the acronym AF and, of course, the concept atrial fibrillation. And here's the results on Dynamed. And really what's predominantly viewable here is that we've disambiguated this acronym. I no longer have 16 concepts creating this massive amount of recall. Instead, I have the precision that I've been looking for. So let's go ahead and take a look at Zoloft pregnancy. So first you see we have a semantic recommendation that has come back that's indicated that we have two concepts at play. One being Zoloft, the second being pregnancy. Now, take a look here. What we've done is we've identified that because Zoloft is a product, we've automatically expanded to its hypernyms in the graph. And what you see here are the concepts IDs associated with those concepts. And right here is a number. This number represents the distance in the graph from the concept Zoloft. Notice that we also did not expand pregnancy because as I had indicated earlier, it was specific enough. And then here we also have a content type recommendation, and you'll notice that the score is slightly lower, and this is because we made this assumption based upon a trigger of searching for drugs. Again, when the medical search platform consumes this data, it's going to use that semantic recommendation as its matching criteria, and it's also going to use the hypernym expansion. You'll see that we're going to be boosting the content type in the ranking criteria. Okay, so here's the matching criteria in the medical search platform. You can see here that we're searching across multiple fields, the content field as well as the header concepts, and notice that the weight is 1 and 2. Here you see the hypernym expansion at play. And what you see here is that a decay has been applied. And that decay is really, again, related to the distance of that particular concept in the graph from my target. So we actually will see these additional expansions in our matching criteria. Now, we're also, as I indicated, going to be applying a ranking criteria for content type. So here's the result on Dynamed. And this first hit is actually a result directly of that hypernym expansion. I was able to find that key document that I was looking for by expanding Zoloft. And you can also see the content type recommendation at play. Now, I had mentioned earlier that breast cancer was a very general query, and I struggled in order to determine how to get my target title to the top. So you can see here that I've semantically understood breast cancer as a singular concept. But here now you can see I have that click-through recommendation. And this is really what's going to help me drive that target title to the top. And again, a category recommendation, as you would expect, because we have a breast cancer category. So again, the semantic recommendation will be used as matching criteria, and the click-through and category will be used as ranking criteria. So here's the use of that click-through rate in the actual search criteria. And here's the actual ID of it. And you'll notice that the boosting is actually taken directly from the recommendation from Query Intelligence. And then here you can see also the category recommendation. So here's the result on Dynamed. So I was able to lift that title up to the top that I so desperately wanted in the lack of everything else being essentially pretty much equal. Okay, let's take a look at this last example for Crohn's children managing. So I have identified that managing actually corresponds to a section in my content. So it's actually a structure in my content. I've also understood that Crohn's is semantically mapped to Crohn's disease, and that children is a population. So actually all three of these recommendations are used as matching criteria. Now here you can see that I'm using the content structure recommendation for managing, and notice that I'm actually going directly to the field that the recommendation indicates that it's a structure representing. And this, as I have illustrated here, makes that connection in my index between this concept ID of management and the one that was searched for under managing. Next, you can see here, I actually have a proximity search here for my semantic and population recommendation. So what you actually see here is this first number is for Crohn's. And the second concepts, we have two concepts that represent children. So here's an example snippet in my semantically enriched index. You can see CD is an acronym for Crohn's, and here's the corresponding ID. And then you can see also children, both of those concept IDs associated. So here are the results on Dynamed. The first hit is absolutely excellent. This is actually a combination of all three recommendations at play. First, you have the management, which although we identified as a structure in our content, we're also leveraging it to compare different components in our index, so different fields in our index. So we have management, Crohn's disease, and children. And this is our top hit, which is predominant. Now the second hit is also excellent. You can see that we have Crohn's disease and children in the title, and then here we actually have the section of management being displayed. So this is really the result of that content structure recommendation. Okay, so I've talked about all these search strategies. So how on earth do we tune these? So what we essentially have done is built our own search admin tool. And really what this tool does is it allows us to engage with our subject matter experts and gain feedback from them. So we have surveys in the system. We have golden sets, otherwise known as judgment lists. And then we also have the ability to compare different experiments or different workflows side by side. So here's an example of some of the golden sets that have been generated by our subject matter experts. So you can see here, there's a series of queries, and really these queries touch on different strategies that we're trying to focus on. I should also mention that we essentially try to prefer golden sets that have been curated. If a golden set is actually created by multiple experts, then we mark it as curated because there's an agreement. If it isn't, then we give a little bit of stock to it, but not as much. So here's actually the page that we give our end users the ability to generate these golden sets. So this is a particular example of trying to generate a golden set for breast cancer. And on the left here, you can see what we're asking them to do is classify the search results. And really, we're asking them to rank them in 3 buckets. Those that are most relevant, relevant, and irrelevant. So notice I'm not asking them to tell me which should be position 2 or 4. I'm saying classify them into buckets. So here is an example of nerve root compression golden set. And you can see here I really have 2 buckets. The upper bucket is most relevant. And what the expert has said is that either of these could be at the top. They don't really care which one, but they should be at the top. And then these are relevant. Now, since I have these judgment lists, I can actually run it against my real search results and then calculate a score or a grade of how close I am to my target. So what I essentially do is I calculate the intersection between the golden set and the actual results. So obviously the higher the overlap, the higher the score. So we do that for the top bucket, and then we also do it for the result set as a whole. So here's an example of some analysis that's been run. So what you can see here on the left-hand side are these golden set queries. And then here is the grading associated with that golden set query for the top results for a particular product. And here is the overall score. So by doing this, we're able to identify prior to pushing out any changes whether we've increased or decreased search quality. Now we also have the ability to run this same analysis against experiments. So here you can see this analysis was run for the current product, which is Dynamed, and then a fuzzy experiment. And you can see we were able to increase the scoring in the top results as well as the overall results. Now, we also have the ability to compare workflows side by side to see if it's something that we would like to promote. So here's a workflow comparison for a group. And this actually is a representation of a couple teammates of mine that won our local hackathon. And what they're doing here is they're demonstrating a workflow that was designed to test personalization. On the left is the default product view, and on the right is if the user was personalized as a pediatrician. So you can see here that this particular title, Acute Upper Airway Obstruction in Children, has been boosted. And then you can see now that we have other titles that are, in fact, relevant, that have a little bit of loft and are more visible. We also have the ability to run blind surveys. So we can run experiments and we can throw it out to our subject matter experts to get their feedback. So here we're running a query for type 1 diabetes, and we're asking them which result set is better. They can choose either side, not knowing who the source is, or they could say they're both bad, they're both good. And ultimately, I can collect statistics on it and then decide what to do. Okay, so next steps on our radar. So we definitely want to get into more contextual recommendations. So if someone is searching for nausea, diarrhea, and they're located in an area where there has recently been a hurricane or some type of disaster, perhaps we want to boost content related to waterborne illness for that particular region. Additionally, different governing bodies have different guidelines and treatments. So when someone searches for something in that area, we may want to boost that content separately. Now, I talked a little bit about our use of personalization through that experiment, but when we disambiguate acronyms, we could certainly take more information about the user when doing so. So in the case of I'm authenticated as an obstetrician and they search for AF, perhaps I should assume that amniotic fluid is their intent versus a cardiologist assuming atrial fibrillation. And then we've also done quite a bit of experiment with chatbots and guided discovery. You can imagine a physician in the operating room interacting and engaging with a search engine, being hands-free. Now, I mentioned at the beginning our knowledge graph having 6.2 million relationships, and then I'm actually only taking a subset of that data. Really, what I would like to do is actually incorporate more of that data, but be very strategic about what pieces I take into account. So I'm able to solve some of these use cases that I struggle with when I just simply rely on is-a relationship or hypernyms or hyponyms. But if I take these other relationships into account, I can have a higher degree of confidence. And then finally, our search ecosystem is actually very much in its infancy. A lot of the code and the examples that I showed today has actually been constructed just in the past year and a half by myself and a handful of engineers. So we've done quite a bit of work in the search prep area. We have a fully functioning content ingestion pipeline where we semantically enrich our infrastructure or our content. And we are able to support experimentation with that. Again, I talked about our search runtime environment, which is medical search platform and query intelligence, and they also share the same architecture upon which you can easily plug in new pieces of functionality. I've also talked about our expert feedback area, and we're going to do a lot more work in the knowledge graph. In fact, I'm in the process right now of rebuilding our knowledge graph in AWS. We currently house it on-prem. And then user feedback. I talked a little bit about this for the click-through rate data, but really we want to get to a point where we're doing automatic feedback loops. Right now the process is more of a regular deployment or release process, where we really want to become a little bit more automated. So thank you very much. Let me know if you have any questions.
Okay, thank you. So, do we have any questions for Erica? I'm sure we do. Oh, I forgot, you do get a free T-shirt. I didn't give out a free T-shirt to the other people who asked questions. Oh, that got some interest suddenly. Okay, Trey, I think you were first.
That was awesome. Really enjoyed it. The decision as to whether to use a criteria from query intelligence for matching versus just ranking, like, do you just generate a bunch of algorithms and try different approaches and see what wins, or is there more to it than that?
So essentially, it really depends on the type of product. So for the product that I was illustrating today for Dynamed, the majority of the real levers are really that matching criteria that are most important. Now, we do use the ranking, but really when I just want the effect to be very slight. So right now, the click-through recommendation just has a very small incremental boost because we were in the process of relaunching this product. So I didn't want to contaminate my search results using old click-through data. So when we actually gather more statistics from the new site, I'll probably reevaluate the effect of that. Now, the content type recommendation is also something that I've struggled with on how much it should impact matching criteria. In some cases, it feels that it should be more overwhelming than it is. So I don't know if you were here when I talked about the example of headache. What we don't want to do is return a bunch of drug content. We really want to show condition content. So in that particular case, the type of content that is returned is critical. For now, it's simply being ranked lower. So it is still, in fact, being returned. So to answer your question, it really depends on the product. And in this particular case, really the ranking criteria is just that incremental tiebreaker.
Okay, thanks, Trey. Do you want a T-shirt? Grab yourself a T-shirt. So whoever it was asked the first question for the previous talks. If you didn't get a T-shirt, do come and grab one later. I'll have to trust your honesty on that one. We've only got a few, and they are rare items. Okay, so do we have another question? There's someone at the back there, I think.
Hi, great talk, thank you. I was wondering, you have this graph, the knowledge graph is actually modeled somewhere else outside the search engine also, and you're pulling in some of this data into these semantically enriched indexes. Is this correct, first of all? If so, do you see use cases already or in the future of having to traverse the graph across not just one hop, for example, but multiple hops in the knowledge graph? And if so, could you talk about some, mapping the query parsing with graph traversal in that use case?
Sure. So at the beginning, I had talked about the volume of data in our graph. So this is actually stored in Neo4j. But when we export a subset of this, we actually internally represent it in our memory structure. Now, we do actually traverse relationships in that internal structure. For now, you can see that I'm really much just focused on hypernyms and hyponyms. But as I had indicated in the next steps, I'll be incorporating more relationships in that I can traverse through. Does that answer your question? Yes, and it is also, in fact, stored externally, but we do incorporate it into query intelligence so that we have high performance when we actually need to, understand semantically and perform query segmentation. So here you can see the content enrichment process goes out and it leverages actually a portion of query intelligence. The same application is holding that vocabulary, and it's accessible to the enrichment process and also our query intelligence, which does the actual query segmentation.
Okay, do we have a further question? Artem.
I would like to know how deep is your knowledge graph? So maybe your query can be too general. For example, you're looking for some specific product, but it maps to drug or something more general in your ontology. So, and you will finally find all of the products and not only the specific one. So you will face then the ranking problem, not the matching problem. So how do you deal with this?
Yeah, so essentially what we do, if I go to this example of Zoloft pregnancy, so what we do here is we selectively expand. So I can't expand for every type of concept, but our knowledge graph has each concept that's classified. So in this case, Zoloft is considered a brand. So brand, I can feel with a high degree of confidence that I can expand it, because usually brands are something that are some, unknown name or some term, but it doesn't actually have any meaning behind it. So really, we're being very selective when we make that decision. Previously, we did actually expand more aggressively, but as you can see here, we just lose too much precision. And even though we could apply a decay vector to make sure that we weight it down, it's still just, if our goal is precision, we just have far too much recall. Does that answer your question?
So you have more specific rules in every category of your filters?
Yeah, so what query intelligence does is it can either expand a query or it can narrow it. So in this particular case, it's doing an expansion, but it's doing it selectively. Yes, so essentially the hypernym expansion, the automatic hypernym expansion rule set has to look at the type of concept in order to decide whether it's a candidate to be expanded. So our knowledge graph has additional attributes associated with it, and I can leverage those attributes to make that decision of whether or not it's a candidate to be expanded or not.
And do you use the length of hops in your graph
Yes.
to make it shorter?
Yes, so actually what we end up doing is we have it configurable so you can say how many hops you go, but actually the default is 3. So predominantly you'll see for these particular examples that it's all 3. But again, because we're applying the decay, we're able to make sure that ultimately we don't lose too much precision. Right, so that example that I had shown where antidepressant in lactation and pregnancy showed at the top was a result of that hypernym expansion, whereas before I wouldn't be able to get that at all. Now notice I didn't actually have any titles that hit in the middle here, right? That were, basically what I showed you is I went from Zoloft to antidepressant. However, if I had content that was closer to that in the graph in Zoloft, it would have been ranked higher.
Peter.
Hi, thank you. I thought that was really inspiring, actually. I thought you brought together a really complex subject area and some interesting technical techniques. My question is, how did you go about working with your experts and your content and your search team? Because it seems to me that's a little bit of magic sauce that you've got here. It's something that wouldn't have been possible if you hadn't got that collaboration.
Thank you. So it's funny you bring that up. So actually one of the wonderful things that I love working at EBSCO is that we have dedicated innovation cycles. So for every 15 weeks of work, we have a dedicated 3 weeks where we can work on any type of innovation that we want. So knowing that I was going to be launching this new product, I built that admin tool as part of my innovation so that I could bridge a gap between myself and my experts. They so desperately want to be engaged in the equation, but how do you do that? How do you have a conversation with someone who's very technical and someone who's, a physician, essentially? So in order for me to create that, I actually went through the path of going through my innovation to get funding from the company to actually go ahead and build it. So I was able to create that strategic relationship between the experts and make them a part of the solution. Because oftentimes your end users will say, why is this ranked here, or why is this ranked there? Well, now they're actually a part of actually tuning search. They have control over the graph. They have control to say how the search should behave. So it engages them.
So, and just one follow-on question from that, because it's impressive how much you've done in a short time. What coverage would you say you've managed to achieve on tuning the graph?
Yeah, so actually I should clarify, our knowledge graph has been around for several years. All of the other systems are new. So query intelligence, medical search platform, our content enrichment pipeline. So the knowledge graph today, when we construct all of the data sources that come together, we have to make key connections in that graph. So there has been some tuning. Let me find that. So there's been some tuning to make these connections because they come from over 10 data sources, right? And there are all these different vocabularies that need to converge together. So there's been quite a bit of work, years of work actually, to get that relationship right. And I'm actually reevaluating this now because actually if you just take the raw vocabularies, the raw medical vocabularies, you'll be missing some key relationships. So we try to make sure that the relationships that we include align with our content. If you're not actually taking that into consideration, I showed you some examples where you'll never actually get benefit out of that knowledge graph.
Fantastic. Thank you so much for your questions. And I'm sure Erica would be happy to chat later about any of the issues raised in her talk. So, quick round of applause for Erica. Thank you very much.
Thank you.